As an expectant parent, you want to set the stage for the best birth experience possible. Today, we'll talk about the option of midwifery care with Linda Ballas, certified nurse midwife at Prisma Health. This is Flourish, a podcast brought to you by Prisma Health. I'm Amanda Wild. Thank you, Linda, so much for being here. I'm so glad to have you.
Well, thank you for having me here. I'm excited to be here.
Now, I know it's been around since forever, but how would you define midwifery, modern midwifery?
Modern midwifery is a health profession, and it focuses on women's health. So it includes anything from prenatal care, childbirth, the postpartum period, which is after childbirth. We also do gynecologic care, family planning, and preconception counseling. So we care for women from adolescence to postmenopause. They would say from the womb to the tomb.
So is there a difference between midwifery care and OBGYN care?
There is a difference. Midwives, we tend to spend more time with our women at office visits. We like to educate. We have a philosophy of care that is different than the doctors, where we see pregnancy as a normal process until proven otherwise. We support and encourage the physiological process for normal labor and birth. One of the biggest things, though, even though we perform the same prenatal visits and we perform standards of care, OBGYN is a medical doctor, so they are trained to manage women who are considered more high risk. They're able to perform surgeries, and they're also skilled in emergent situations. So that is one of the major differences.
So most midwives are not doctors. What kind of education or certification are midwives required to have?
Well, certified nurse midwives are nurses who have gone on to get our master's degree or doctorate degree in midwifery. And then after that, we must pass the National Certified Nurse Midwife examination, and that's through our American Midwifery Certification Board. So our training, we have probably, by the time we're all said and done, we have probably close to 6 to 8 years of training.
Wow, that's quite a bit. And so you've seen a lot before you're actually certified.
Right. We have to do a certain amount of hours in order to get your degree, and then you go on and take the board to be licensed.
So can anyone receive care from a midwife? Like, who's a good candidate for midwifery care?
Well, that's a good question. It would be great if everybody could see a nurse midwife. And in fact, there was a study, it's called the Cochrane study. It's a pretty well-known study, and they looked at midwives and found that majority of women who had a midwife, a lot of times, most likely they had less intervention, better outcomes, and they were more satisfied with their experience. And so they're at the final part of this, they did recommend that most women should be offered midwifery care, but not everybody can see a midwife. Some women are just not good candidates. For example, they may have a high-risk medical condition, type 1 diabetes or uncontrolled hypertension. If a woman had multiples, if they were carrying twins or triplets, they would best be served seeing an obstetrician.
Midwifery often conjures up a range of images, but often people think of pioneers roughing it out on the prairie or water births at home. Can you tell us more about what really is the midwifery birth experience?
So the midwifery birth experience, this is going to be so confusing, but I'm going to talk about the certified nurse midwife because there are other different midwives. They're different state to state. But a certified nurse midwife, we can either deliver at a hospital setting or we could be present at a birthing center. And some states also, they can do home birth. So we here at Prisma, we attend birth in the hospital. So with a midwife, you can get an epidural, you can choose to have a water birth. We support a woman's decision in what she would like to do. So we provide that emotional support during labor, and we like to empower women to have like a positive birth experience. And I probably said this back before, one of the things we do, especially at our office visits, is just to educate so that a woman knows what to expect to the most part during labor. We go over prenatal care, eating right, taking good care of yourself. So we're there during the labor, so we actually help women as they are going through, recommend different techniques to help manage their labor. One of the myths for midwives is that you can't have medication, and we can prescribe medication. And if somebody wants an epidural, that's perfectly fine. They can have an epidural as well.
Are there any other myths you'd like to dispel about midwifery?
One of the myths is that we only do home births. Like you were saying before, when you picture a midwife, you picture like that old-time granny midwife who's probably never even had a high school education going house to house to do these deliveries. And now in modern times, it's not like that. So a majority of midwives attend births in the hospital. Very few actually go to homes.
Do you work exclusively in the hospital in your practice?
Yep, exclusively in the hospital. We have an office where we see women either prenatal or for gynecological care, or some want counseling and family planning. That'll be done at our office. And then if we are on call, we are at the hospital.
So much support. Do midwives only provide maternity care, or can they provide primary care as well?
We do primary care. And we see women through their annual visits. If somebody wants preconception counseling, we do a little bit of infertility workups. So we will start basic care, and if somebody risks out, for example, they need maybe to see a fertility specialist, we'll refer that to them. Or if they tend to have something wrong and they need to see an endocrinologist, we'll refer out. Or if they need surgery, we'll refer to a gynecologist.
Can midwives prescribe medication?
Yes, certified nurse midwives can prescribe medication.
So to sum this up, going with midwifery as an option is getting a lot of support and education, including being right there for the birth and afterwards as well. And it includes women's gynecological care from adolescence on.
Mm-hmm. You summed it up very well.
Well, Linda, thank you for sharing this detailed information. This is a good, solid foundation for exploring the wide world of midwifery. Thank you so much.
And one thing I just want to say is for midwifery candidates that I neglected. So if someone is looking for that natural birth with little intervention and they want to be supportive, midwifery is the way to go.
How many births have you attended, and are they all completely unique?
I've been a midwife for 25 years. And in 2006, I'm going to sound so old. In 2006, I hit 1,000. And then after that, I stopped counting. So I want to say I've done a few thousand births. And I'm going to tell you, everyone is unique. No two births are the same.
So you really have to be on it, present, using all your pool of knowledge for each individual client.
Yep. That support, patience, and the knowledge is so important.
Linda, thank you so much for sharing this detailed information. This is a good, solid foundation for exploring the wonderful wide world of midwifery. Thank you so much.
Oh, you are so welcome. You have a wonderful day.
For more information and other health podcasts, go to prismahealth.org/flourish. This has been Flourish, a podcast brought to you by Prisma Health. I'm Amanda Wild. Be well.